Hi, my name is Robert Shelley with Shelley Law, and my law firm assists CRNAs with employment contract and independent contractor agreement issues. Today I'm going to talk about common compensation structures for nurse anesthetists. So, if you are a CRNA and you are, completed your schooling, certified, ready to go, there will be kind of a different way of being compensated than you were as an RN. As a CRNA, it's very likely if you take any kind of position, you will have either had to have signed an employment contract or an independent contractor agreement. When you're working as an RN, that almost never happens. Maybe if you're doing some travel nursing, but if you're just working for a local hospital in the ICU, you're not going to sign an employment contract. Now, the most common, at least in my experience, type of arrangement is as an independent contractor. Most CRNAs work as independent contractors. Not saying all of them, obviously, but more than 50% work as independent contractors and likely have multiple, independent contractor agreements with multiple facilities. So, what are the benefits to the CRNA? Well, if you've signed an independent contractor agreement, it should allow you to work for multiple places at the same time. If you signed an employment agreement, normally there'll be some kind of exclusivity provision that essentially prohibits you from working anywhere else during your employment without written approval from the employer, or there'll be a non-compete that applies either during or after the contract is terminated, which could once again kind of limit your opportunities. The benefit of an independent contractor agreement is it really shouldn't have either of those things. There should be no exclusivity provision, and more likely than not should not contain a non-compete, which just gives maximum flexibility to the CRNA. Now, how are you paid? Well, that can vary from organization to organization. If you're an independent contractor, it's very likely you're not going to make a straight base salary. It's going to be either hourly, per shift, or perhaps some kind of productivity arrangement, although that's not as normal for CRNAs. And so obviously it's pretty simple if you have an hourly rate or a per shift rate. If you are paid on production, that simply means usually it's net collections, which means you'll get a percentage of whatever the practice collects on your personally performed services. A normal percentage, anywhere between 20 to 30%, I think would be kind of a normal amount for someone to make as far as their net collections go. It's pretty unlikely that a CRNA would be compensated via work RVUs. Maybe if you're employed with a hospital or healthcare network, they generally do not use net collections. They'll use work RVUs, but that's an uncommon way for a CRNA to be compensated. Now, if you're working as an employee, so like a full-time employee with an organization, they can utilize all of those or a kind of mix or match to make a hybrid compensation structure. But in most scenarios, if you just get paid a straight base salary with no productivity, it's obviously pretty simple. I find the most effective contracts kind of contain both some kind of minimum guaranteed base and then also some kind of productivity incentive, which incentivizes the CRNA to have more cases, which means they get paid more. It's just human nature that you're going to work harder if you have the opportunity to make more. And I think for both sides, that makes the most sense. Now, one other thing to think about, malpractice insurance as an independent contractor. Now, you're most likely going to have to get your own malpractice policy. And if you are working in multiple locations, you will have to get, depending upon whether you have claims made or occurrence-based malpractice insurance, a tail policy for anywhere where you've had a claims made policy. So what you want to make sure is, like, let's say you're working at 3 or 4 different places. Well, what you don't want is to, leave a position and have to purchase 3 or 4 tail policies. That can get very expensive. So you want to make certain that whatever insurance company you're going with, you will have either occurrence-based coverage where it's a little more expensive, but you don't have to worry about paying tail, or they will roll in all of your old tails into your current policy, so you don't have to pay tail insurance every single time. There are situations where the employee, obviously if you're an employee, very likely the employer is going to pay for your tail if it's a claims-made policy. There are even some independent contractor agreements where whoever you're working with will cover your malpractice insurance as well. In that scenario, make absolutely certain that they are going to pay your tail insurance and that you're not stuck with it. Normally, tail is around twice what your annual premium is. It's not inexpensive for a CRNA to have malpractice insurance. So just keep that in mind because it can add up over time. So those are kind of the most common ways for CRNAs to be compensated. If you have any questions about an employment contract or independent contractor agreement as a CRNA, contact my law firm at the contact info listed below in the description. And I appreciate you watching the video. Thanks.